All right, good morning, everyone. We'll go ahead and get started. I have a couple after 10. Thanks for joining us for the last April Zoom call. We're happy to have everyone on today. As you can see, we have conference call bingo on the background. I thought that would be quite enjoyable for folks who've been having lots of Zoom meetings recently. You might have been doing some of these games with some of your meetings. Hopefully there won't be too many of those today. But we're going to go through some of the updates that we've been finding recently in the last week or two as it relates to the coronavirus and social work. Then hopefully if you all have resources to share or questions, feel free to type those into the chat box. You can unmute your line too as we get to those sections. So, and if folks have any other questions, you can use the chat box, or if you go into the participant section, you can raise your hand if you're more comfortable doing it that way. So kind of our goals today, like the last couple of weeks, is just to make sure you all are as up to date as we are on everything going around as it relates to the coronavirus, and then discuss advocacy and resources to share. So there's some new items on today's agenda. We have some new policy updates and action, both at the national level. We're going to talk about the budget, the state budget, some of updates from the mental health hotline. There's been a lot of social workers in the news the last week, so we want to spotlight those folks as well as talk about some opportunities for maybe some of you all to get spotlighted if you are interested in, some billing resources, and then just some other things for you. All right, so with that, I'm going to turn it over to Algeria to give a few updates on her end.
Hi, everyone. I feel much better than I did last call. So thank you for asking me. So this is just showing you again where to find some of our COVID-19 resources. We did update a few bits of information around the Michigan COVID-19 resources tab. So if you haven't looked at that, please do. Also, I'll be updating the legislative updates tab. It's a little bare right now, but there are a couple of other newsletters that I've sent out that I need to update and put on the website. So please take a look at that when you get a chance. So our action alerts, we've sent out a few, and we'll probably continue to send those out just over the course of the time because there's still more work that needs to be done. So some of our action alerts that have come from our national office as of recently are urging CMS to expand telehealth to include audio-only devices. I believe Dwayne will go over this a little bit more throughout the PowerPoint slides. But as we mentioned before, telehealth has been expanded around Medicaid for visual and audio. However, for Medicare, we still are behind on including just audio-only devices for full 45-minute sessions. So I think Dwayne will cover this a little bit more. There's a practice alert that went out for national that'll give you information about what billing codes you can use and what types of telehealth services can be used for Medicare. Another very important action alert, if you have not taken action on, is just encouraging Congress and the White House to approve PPEs for social workers. We know that as we look at the states bringing in more personal protective equipment for hospitals, that's a place where it's needed, but we also need it in other spaces and places for social workers. So whether that's APS, CPS, residential care settings, we need more PPE, especially if we look at soon opening up the states again in the economy. So please take action on that. And then also expanding paid emergency leave to allow workers to recover from illnesses or care of loved ones. We're asking that people contact their legislators or Congress members so that we can continue to expand FMLA to individuals who are also caring for their loved ones who are recovering from coronavirus or who have passed from coronavirus. So I see Dwayne put that link right there in the chat box, so please take a moment to look at that. Okay, and I wanted to just update you all here, moving right along to just some of the recent policy changes and executive orders that are relevant to you all. So first, Governor Gretchen Whitmer, I believe it was on Wednesday, she issued an executive order extending and expanding eligibility for unemployment benefits. So now I know like barbers can get it, folks with who have paid gigs or in consultation type of work can now apply for unemployment. But also this expansion now includes anyone who voluntarily left a job after accepting new employment, but were unable to start their new position due to the pandemic. So please, if you need that, take advantage of it. And if you know clients who need it, please direct them appropriately. I know the unemployment office, they are on a tight window, so they're looking at certain dates for certain last names. So please take a look at that information as well. Governor Whitmer also created the task force on racial disparities because we know that the COVID-19 pandemic has disproportionately impacted communities of color throughout the state. So while African Americans represent 13.6% of Michigan's population, they represent over 40% of the deaths from COVID-19. So the task force will act as an advisory capacity to the governor and study cases of racial disparities and the impact of COVID-19. And they've appointed those folks to the task force. They've also, the Department of Health and Human Services has also expanded some training to teach individuals about health equity. So we have that under the Michigan COVID-19 Resources tab. So please sign up for that if possible, just to learn a little bit more about health equity and systemic racism and how that operates and how it's affecting communities of color right now. Also, expansion of COVID-19 testing has occurred. We're trying to reopen the economy and reopen the state as soon as possible so everyone can be tested now. And they're putting a lot of emphasis on essential workers to become tested. So whether you're symptomatic or asymptomatic, you can get a test. You won't need a physician's order to do so. And co-pays for testing are completely covered. So please, if you are out and about, go get tested. Additionally, I'm really excited about this next tab. Michigan was awarded 2 federal grants to strengthen the behavioral health services during COVID-19. So MDHHS, they were able to apply for 2 different grants. I believe one was a SAMHSA grant and the other was a FEMA grant. And the funding, what it does is it allows them to do 2 things. One is to create a crisis counseling program, a hotline for short-term and long-term care or long-term needs for individuals with mental health needs. And then the other is to hire and train more needed staff within the community mental health system. So we're really excited that they're putting mental health at the forefront. And I'll talk a little bit more about this here soon, but we are working with the Michigan Counselors Association and the Department of Health and Human Services to create a referral system so that we can be a second tier. We can have pro bono clinicians operate in a second tier capacity to these hotlines across the state for individuals who maybe they don't have Medicaid, they may have commercial insurance, or maybe who they need just, longer term care than what can be provided on these hotlines. We'll have clinicians available to help on all of those hotlines, including this new crisis counseling program that's coming. And then last but not least, I'm hearing that there will be a potential extension of the stay-at-home order. I'm seeing things that are saying till May 15th. We'll see. I believe we'll hear more about that today, but I do believe there will be some relaxing of other requirements as we keep this extension going. All right, so just again about another executive order. We've talked about this before, but I just want to make sure that I continue to reiterate this on these calls. Executive Order 2020-49 is around continuing education and licensure renewals during COVID-19. I'm looking at Dwayne change his background here. It's funny. So anyway, this executive order has created the opportunity for individuals who may need to get their license renewed or may need continuing education to not worry so much about the April 30th deadline. If they can absolutely not complete it, they can do COVID-19 work to meet those hours, and the license will automatically be renewed. However, we're just still saying to social workers, please make sure that you document everything and still take active responsibility to get as much of the information as you can. Okay. Also, I want to talk a little bit about state budget projections. NASW had the opportunity to sit in on a call with Senator Stamos, who is the chair of appropriations, last week, I believe it was, just to talk about budget, right? Because before COVID-19 was occurring, we were focusing on a state budget. And so because COVID-19 has occurred, they're projecting a potential budget loss around $1 billion to $3 billion. However, they're still actively going to be working to deliver a budget to the governor by July 1st, as statute states. And so once we come from the stay-at-home order, they'll be rapidly focusing on the budget. And currently, they can only focus on COVID-19 relief dollars once they return. So what does that mean? That means that, we at NASW will be actively trying to figure out what needs to go into the budget that can support our clients and social workers from COVID-19 and beyond. And so we talk to them a lot about mental health and the need for mental health, and it is on the forefront of the appropriations chair's mind, Senator Stamos, and he suggested that, we continue to work with the subcommittee chairs, which is Mary Whiteford and Abdallah Hammoud, Senator Whiteford and Abdallah Hammoud, Rep. Hammoud. So we'll be doing that. We have great relationships with them, and we'll be making sure that mental health is certainly included in the budget. All right. And then I just wanted to put the Warmline back up again for everyone. The Warmline again is the hotline that is held by peer support specialists to focus on behavioral health issues, and individuals who need ongoing care are then referred to the Community Mental Health Association crisis line system. I will say that the peer support specialists who answer the phone, they're really only supposed to talk for about 20 minutes. And if people need more ongoing care, then they're transferred to the community mental health system. So this is the where we decided to, come together with the Counselors Association to really help fulfill some more gaps in the system. The Warmline's amazing, but based on our conversation with some of the creators, there's still a greater need for additional mental health care. So we will put that link again in the chat box to the survey. So if you are interested or able to provide pro bono teletherapy care, we'd ask that you fill out the survey. And it'll go out in an email format today as well. But once you fill out the survey, you'll be put on a roster, and this roster will be shared with the Warmline. It'll be shared with Community Mental Health Association. It'll be shared with the Crisis Counseling Program. And it'll serve as a second tier for folks who need ongoing care or who don't have Medicaid. Again, I just also wanted to put up there the first responders line, and the healthcare provider support hotline ran out of Wayne State University. Again, it's a collaboration with their School of Social Work, Department of Psychiatry, and Nursing school, and it serves as a crisis hotline for anybody on the front line. So anyone who's considered an essential worker doing frontline work who may need some additional emotional support, there is a hotline that you can call. If you are interested in still volunteering with that hotline, I believe they do have a link where you can sign up to provide additional support to frontline workers. I think our next step is also trying to see if we can share that referral line to the healthcare provider support hotline system. That way we have multiple people available in multiple areas. Someone is asking, yep.
You might be going for it.
I'm just there's a lot of questions coming in on this thing. Let's see here. Okay, someone says, are there crisis hotline volunteer opportunities for clinical students? Really good question. I know that I believe the healthcare provider support hotline is strictly for clinicians. And I know the volunteer hotline roster that we're creating right now, I believe it says that it's strictly for clinicians. But I do believe, based on our conversation that we had with the mental health counselors, they mentioned that if you are in a field placement or you have a field supervisor, someone actively supervising you, you can still volunteer. But if you do not have a supervisor, it is just too risky. And I think it would require more training that we don't have the capacity to meet at the moment. But if you do have a field supervisor who can actively supervise you, I believe you can volunteer on the crisis hotline system.
Algeria, I'm wondering if people are curious about the Warmline as a place to volunteer. And that's something we could check with Jean Dukarski.
Okay. Yeah, I know they mentioned on the Warmline needing additional support. So we can check with the Warmline folks and see if that could be a place as well for clinical students.
There might also be some opportunities to volunteer for those sort of organizations or initiatives right now. Even if it's not in a clinical capacity, they may need support getting out the word, doing social media outreach, that sort of stuff. So I would recommend reaching out if you have some other skill sets that maybe aren't clinical that you could help out.
And there is also the volunteer website that the department has, the MDHHS volunteer website. So if you are just looking for opportunities to volunteer, I know that could be a good space to look as well.
Yeah, and I'm going to post that right now in the chat log. Okay, so a couple other ways that we wanted to mention to get involved, because we've been getting asked that. And some of you, I know somebody, I think it was Ebony in the chat log, asked about contact tracing. This has been something that's been brought up by a couple of social workers to us as an opportunity. So this is something that most people never heard about until maybe the last couple of days. But their MDHHS is launching large-scale volunteer contact tracing right now. Basically, these are individuals who will be in contact with folks who do have COVID-19 and will kind of help track where they go and who they interact with. So it's very important to know where the paths go to help find a solution and see how this spreads. So they are looking for volunteers. I know that across the country that they've been getting inundated. I think I was listening to NPR yesterday. I think before this there was like 1,200 or 1,500 contact tracers across the country, and now there's like 500 times that many just in the last couple of weeks. So lots of people are volunteering because they have some time to do that. If that's another option for folks. Seems to have somewhat of a clinical and a macro hinge to it. And then the other way specifically for social workers to stay connected and get involved, and we talked about this last Friday, is starting a clinician support meeting. So it'll have a little bit different focus to what this call is, where we can really talk about what's going on with your clients, what's going on in your agency setting, how you're adapting the needs as clinical folks that you are finding as this continues to go on. And if we're going at least until mid-May, it'll be a few more weeks. So we're going to have our first call for that next Friday at this time, 10 a.m., and that's going to coincide with our normal private practice group. And then at that meeting, the group will then kind of figure out how often do they actually want to have that, when makes the most sense. So we're hoping that folks will join that private practice call. We'll be sending out information on how to join that this next week sometime.
Yeah.
We want to make sure folks are staying connected after this.
Dwayne, you have Monday the 1st, it's Friday the 1st.
Oh, yep. Good call. I'm just going to go ahead and change that right on in there. Let's make sure that's the actual date too. Good catch. Yes, Friday the 1st. And the private practice group meets the first Friday of every month from 10 to 11 for anybody who'd want to join that anyway. Okay. So as we move on to the agenda, if folks have specific policy questions, please feel free to add those into the chat box. I know Algeria and Max are going to be off here shortly to be on a call with the governor's office. So any questions you have for them, please feel free to ask those now. NASW has been getting reached out to by several media outlets, both at the state and the national level. We are doing our best to pluck and highlight as many social workers that are doing amazing things right now as possible as we get those opportunities. We know that some of you out in the field have also been doing your own media outreach or have been reached out to by your local media, which we think is fantastic. The more of us we can be visible right now, I think the better. And we know social workers are working in such a variety of capacities that there is no shortage of stories. And so these were just a couple that came out this week. And a couple of them are hospital or medical social workers. From Michigan Medicine, we have one of also the Detroit area, another Detroit area hospital. And then we have school social workers starting emergency food pantries in Madison Heights. And I know that all of these social workers, we've gotten many other outreaches as well. So as we get those stories, or if our national office gets a plug, they reach out to us, and then we send any contact information over to them. The national office is actively looking for social workers to share their stories. So if you would be interested, or if you know of a social worker who you think would be good to and is able to talk about their experiences right now, we know sometimes that's not the case depending on your work setting, please send that over to me, and I can forward that on to our national office. And then if we get anything here locally, we will make sure that those contacts are made. But we love seeing positive spotlights of social workers right now. And we also just kind of want to hear what's going on in practices too. We know that some of the hospitals are laying off staff or furloughing people. Social workers sometimes are in a weird capacity in medical settings these days. So we know that some are essential frontline employees, some are working from home or remotely. So we want to continue to hear what's going on in your practice. Shelley asked, do the social workers have to be NASW members? No, but it's preferred. No, we want to highlight as many social workers as possible. Okay, a couple billing updates. You may have seen these came out from the national office this week, but I wanted to make sure that I showed folks this. So they sent out a couple of alerts which clarify some coding, and I'm going to click so you can see them. This first one actually has some of the place of service and modifier codes listed specifically for CMS. I know we talked about this at our meeting a few weeks ago, but we wanted to make sure that the national office is trying to continue to put out updates around that. So some of the codes here, depending on the setting, the modifier code 95, which we talked about, and then the other alert was specifically around CPT codes. And this one I think folks will find pretty helpful too, and they specifically lay out the code number and the time value with it. So for clinical folks, these are pretty good resources, and I'll add both of those links also in the chat log as well as for easy access. The national office has been putting out a lot of resources and continues to work on this. So if there are other things that would be helpful, please let us know, or we can shoot those up to the national chain. The other resource that we'll be putting out next week is Ellen Crane, our Region 10 rep, as well as she's been on our ethics committee, has tweaked the telehealth intake form specifically for private practice users. She's said that she's willing to share that as an example for folks. So we're going to send that out, as well as the examples through the national office and through NASW Assurance Services. So folks all have those three as a guidepost as you move into kind of the telehealth space, or maybe confirm your telehealth practice at this point. Okay, so then talking a little bit about some of the LARA updates. We have went over this, but just in case folks are new, for new applicants or students who are graduating, all new applications should still be paper mailed to LARA, including your payment. So when you're applying for your limited license, make sure that you print off your application from the LARA website, you mail that in. You'll still, they're processing things at a pretty normal pace right now. And then once you get your account set up, they will mail you back a letter with your login for the LARA website. At that point, you can email in your transcripts and have your fingerprints taken. Fingerprinting is still happening all across the state. There are as much limited fingerprinting locations. However, because they are still operating, LARA is asking folks to still get that requirement. They're not making exceptions at this time for that. So if you are a social worker that is either getting your license reinstated or a new social worker, this has been a little bit of a frustrating piece in the last couple of weeks. We know that there are very few fingerprinting organizations open, however they are, and when spots do open up, they tend to fill up almost instantly. So we know that folks who've been experiencing this have had to be checking the LARA website several times a day. Sometimes there still isn't a space open up. We're in constant communication with LARA right now, so we are sharing those concerns with them. However, at this point, they are still requiring the fingerprinting. In Executive Order 2020-30, LARA may suspend those requirements. However, they have not done that for social workers to this time. So just like Algeria was talking about with continuing education, document, document, document. So what we've suggested to social workers who have tried for a week or 2 weeks to get a fingerprinting date with no success is to screenshot all of the fingerprinting sites in your area and send those over to LARA in an email and let them know that you've tried that. And hopefully if this continues to go on for a long time, and we know folks are graduating here like now, in the next couple of weeks, that influx of people will continue to be greater, especially in the short term. The other executive action that folks should care about is the one around, also was in 2020-30, can non-Michigan social workers see Michigan clients? Yes, this was one that Governor Whitmer opened up. So as long as somebody is clinically licensed in another state, they are able to see Michigan clients. It is not true vice versa. Every state has made some different rules around reciprocity right now. For a full list of where you could practice as a Michigan social worker right now, you can go to the ASWB website, which is just aswb.org, and they have a comprehensive list of what states have done to this point. All right. A couple of upcoming virtual events that I want folks to be aware of. These are just new out this week, but they're both scheduled for next week, so I wanted to make sure folks knew about them. Both on Monday, we are going to have a virtual lunch, a West Michigan virtual lunch from 11:30 to 12:30, and registration information you can find on the NASW Michigan website. Just another opportunity, especially if you're a West Michigan social worker, to network and to talk about what's going on. And then Monday at 6, we're having a social work student watch party. So anybody who may be interning students or is a student on this call, we want our BSW and MSW student reps on our board want to have an opportunity for students to talk about their experiences, kind of having this crazy experiences to end their semester, to their graduation. We know the job market is also really weird right now. So just to have some real talk for folks who are entering the field. The national office has put up another new webinar. It's going to be on May 6th that you can register now, helping social workers manage our own grief and loss during COVID-19. I know we've been reached out to, had some members reach out to us here locally asking for this particular topic. So I was glad to see the nationals put this together. It is free, so I would probably, if you are interested in this topic, register sooner rather than later because it probably will fill up. And registration was emailed out a couple of days ago through the national office. A couple of self-care podcasts I wanted people to be aware of. So NASW is doing a podcast series right now. They've had quite a few topics specifically around the coronavirus. And then if folks weren't aware, Brene Brown also has a podcast that is really good, and she has been talking about a lot of stuff related to the coronavirus right now with experts, including around loneliness and connection and the permission to feel. And I know social workers are using a lot of podcasts and mindfulness tools. The governor had partnered with Headspace, the app, to offer a free, basically, month for folks for a mindfulness tool across the state. But if you are finding specific resources that are really good for your own mindfulness and self-care, please feel free to put those into the chat box below. We'd love to share as many as possible. Some other updates. So if you have liability coverage through Assurance Services, they are allowing deferred payments for up to 60 days for folks if you are in a financial hardship. For folks who have expiration dates April, May, and June. So if you have questions about that, I would highly recommend checking out the Assurance Services website or contacting your rep directly. That may get extended depending on how long the stay-at-home orders go. Like I mentioned earlier, Algeria and Max are reaching out here shortly, and they'll be joining a call with the governor here at 10:30, so they're probably on that right now. And Max had put into the comment box about the Warmline, and at this time, they're staffed only by trained peer support specialists. So unless, I know some data about BSW, so unless they're also trained as a peer support specialist, they wouldn't be able to specifically volunteer for that helpline. The other reminder is voting is open for both the national NASW and the state NASW elections. So if you get a chance and have a few minutes, please vote in those. It's how we choose our chapter leaders, both at the national and the state level, and we want Michigan to have a large representative body voting for that. The email was sent out on Monday with voting instructions for the statewide elections, as well as it's on the main page of our website. The only thing you'll need to vote is your member number. And if you don't know that, if you go to socialworkers.org and if you log on, you should be able to get that no problem. Or you can just give us a call and we can get you that. There are places that are actively hiring right now. I know that many organizations have hiring freezes, but many of the healthcare settings like the VA and MDHHS have many different hiring options. So if folks know of folks who are looking for jobs right now, please feel free to direct them to that. If your organization is hiring, please forward that on to us, or you can post jobs for free on the NASW Michigan website. We want to make sure that, especially as it gets close to graduation, if you're hiring limited license folks, that we have as many options available for people, because we know that it's a very strange time to be trying to enter the workforce for social work, and it's going to be probably a struggle for folks. And so we want to make sure that there are, if people are hiring, we have those positions online. So since this is our last scheduled weekly call, we really like how these have been going. So we are going to continue them, but in a slightly different capacity. We're going to do a bi-monthly member check-in. So it's going to be the same time, Friday from 10 to 11, but it's going to be every other week starting the second week of May, so 2 weeks from now. In the in-between, we will have that clinical group next Friday, but the full member conversation will happen the second Friday, so May 8th at 10 a.m. Are there folks that have any other specific questions online, I wanted to make sure that if you all have anything or if you want to share anything of what's going on in your practice, this is the time we have to talk about that now.
Dwayne?
Yeah.
Hi, this is Ken Sherman. How are you?
I'm good.
Good. I do have a question about the Warmline. So if a social worker is considering volunteering on the Warmline, I have two questions. One, what about liability issues since it's a volunteer position? And then my second question is, in your role as a social worker, what happens if mandated reporting issues happen to come up?
Both good questions. So for the Warmline, you do have to be a peer support specialist to volunteer for that particular line. The other one through Wayne State is a more first responder line. So really you're just assisting, usually it's medical professionals, nurses, those sort of folks that are just dealing with stress and anxiety right now. Those are the primary things that we're finding. In terms of liability, we would absolutely recommend that folks who are volunteering in those capacities have liability coverage as a backup. You're not, for most of these volunteer opportunities, you're not talking to folks as a clinical social worker. For the peer support line, you're talking to them, I mean, as a peer. Well, yes, our training does come into play. The mandated reporting piece, that's a good question. I will need to probably hop in, talk to Max about that piece. I don't know. I don't have a great answer for that. I don't know if anybody on the line has thoughts about the mandated reporting on those lines.
Because I really think that should be clarified before, somebody, I mean, the chances of it coming up may be, whatever, but, if it's a possibility or if it does come up, I mean, you can't not, do what you're mandated to do. So.
Vicky wrote in the chat log, as far as she's aware, peer support specialists are also mandated reporters, at least through crisis text line. I see some folks' heads nodding. And that's something, yeah, Sarah, we'll email the organizers of the hotline to both the Warmline and the Wayne State hotline, because that is a good question for clarification.
Thank you.
Yeah. Other thoughts? How are folks feeling? We're now a month in. Vicky, I see your hand raised. You're unmuted.
I feel like we are all getting to a point of, at least at my work, kind of getting to the point of, is this really our new normal? I do Medicaid waiver, and so we're doing all of our assessments via conference calls. We're not actually seeing our clients in person, so it's a kind of hard because a lot of what we do assessing them and assessing their eligibility and things like that are things that we just observe from them interacting with their family members or interacting with us and observing their home environment, and now we're just taking everything at face value and trying to contact family members and doctors and things like that to just try to say, is what's being reported valid? And we're getting direction from the state that this is our new norm, at least for a while. They're saying even once some of the restrictions come up, it's probably going to stay this sort of over the phone type of interaction for quite a while. So.
Other folks experiencing similar stuff with their agencies? I know what we were finding this week is it seems like this was the first week that somewhat business was feeling a little back to normal. People were starting to get a lot more phone calls, emails were starting to go out kind of back to a regular pace. I think people have started to adapt and kind of understand the flow of work from a home setting a little bit better as we've gotten into 1 month in. But I know it's going to continue to adapt for folks. Ebony asked a question, is there a resource page for people dealing with COVID wage loss? Now, Ebony, I'm going to open up your line if you're on and see if you can maybe clarify that a little bit. You're unmuted.
Yes, I've had a lot of clients who have asked, they haven't received their unemployment, so they're wanting for payment for DTE, for their water, for their cell phone bills, etc. So they just wanted to know if there was, any help out there.
It's a good question. I know that the U of M School of Social Work has put out a resource document about things in the Southeast Michigan area, as well as Wayne State School of Social Work has also put out some resources around that. Many of the utilities, I think it's kind of just been a hodgepodge of what folks are doing at this point. I know in terms of auto insurances, depending on who you get your auto insurance through, some of those have been issuing payments back to folks or partial payments. I know my auto insurance is doing, I think, 15 or 20% per month that they will reimburse all of their policyholders. But I think I haven't seen any statewide site yet for all of that. If anybody else has any good resources, I'd love to hear that.
Thanks.
Pat said in the chat box, her agency is starting to get calls for services at a higher level than the last 3 weeks. Still not at the old normal level, but at a higher rate. I know that many clinical folks were finding that for the first couple of weeks that services were way down, or folks were just no call, no shows for appointments. Hopefully that is rebounding a little bit. I think as the governor and at the national level, we continue to talk about mental health as a piece to this. Hopefully that we'll see that rebound happen. Ebony, Karen did share in the chat box, United Way and USA.gov may have resources for utilities, and maybe checking out 211. I'll let folks type into the chat box, but while we do that, I'm going to just bring up the NASW Assurance page again. I know I showed this last week, but I just wanted to make sure for folks who are on the line now, there are a bunch of really good resources here for folks. If you click the Consider Teletherapy link, oh, they've even updated it since last week. Oh, it looks pretty. So there's a bunch of stuff here that may be helpful for folks in a clinical setting. The frequently asked questions was one that I clicked on last week. Oh, they really have changed it. So you can even choose by category: consent, HIPAA, licensing, records. Nice. So is FaceTime a safe way to communicate with folks? A lot of these you'll see is if you have secure internet access. Is Skype secure if you have secure internet access? But there are some of those commonly asked questions for folks here. I know they also had, if you're on that main page again, the teletherapy consent form. So this is one we're going to send out to folks next week with the one, the national office also has one, and the one that's been tweaked by our Region 10 representative. The other resources in here, the webinars that will directly link to some that through ASI, so risk management during COVID, technology and social work standards, and most of these are free for members. whether or not you have the liability insurance through ASI or not. Through the national site, again on the main page, the very first resource is their COVID update there. So there's lots of different categories. If you're interested in any of the advocacy alerts, you can click on that link. And then they do have plenty of self-care resources as well, some free self-care practices and websites there, some research, their podcast series, and some publications for social workers. We didn't talk about student loan forgiveness, but that's something that we've talked about continually the last few weeks. So if folks' loans are being just on pause right now nationally, there's a link for social workers as volunteers on the main page. Okay, let me go back to that real quick. That probably was, just see where folks saw that. Oh, probably here? Yeah. Maybe. Volunteer liability. Yes, okay. So during the pandemic, the NASW Risk Retention Group is providing volunteer social workers who deliver uncompensated clinical care with free liability insurance. That's great, actually. Thanks for pointing that out, because I didn't even see that. So if you are volunteering or know social workers who are volunteering right now, this is a really good backup for them. It really, I think, also talks about the difference, and I know this isn't a liability insurance call, and I am not a liability insurance expert by far, but when you look at the different websites for liability insurance right now that have options for social workers, you can tell which one is run by a board of social workers, and specifically for things like this when we are adapting in a crisis. So this is a really great, and I'm going to make sure that I put this in my updates that go out to members next week. Yeah, so I'm going to put that link also in the chat box for folks. So please feel free to share that, and I'm going to also put that on our social media right after this call. All right, any other questions, thoughts, concerns? Good to see you all.
Hey, Dwayne.
Yeah.
Hi, it's Ken again. I just wanted to, when we were talking about utility resources, I just wanted to mention SAW, the Heat and Warmth Fund, as a utility resource.
What was the name of that?
SAW, THAW. It's a Heat and Warmth Fund. It just might be down in Metro Detroit. I don't know if it's under another name in other areas, but in southeastern Michigan, we have a utility assistance program called SAW, THAW, which is a Heat and Warmth Fund.
No, thank you for sharing. I will post that really quick.
And they help people avoid, shut-off notices, with their utilities during the winter or the summer months.
Yeah, it looks like that's thawfund.org, and it's the Heat and Warming Fund. Great, thank you for sharing. During this time, we also have created regional Facebook pages for every one of our regions that currently has a board member. So we highly recommend, if you're on Facebook, to join those Facebook pages for your area, and that's a really good way to share or find resources specifically in your part of the state. Vicki said our DHHS workers also said that the stimulus checks are not affecting eligibility to Medicaid programs at this time either. That's great. Yeah, perfect. And we know that one of the things Algeria talked about is funding is really important right now. And as this pandemic continues to go on, we know that there will likely be additional rounds of stimulus. There was another bill passed yesterday that doesn't provide individual support, but we know that there probably will be another one of those bills if this continues to go on. So we also want to make sure that folks who are left out of that initial stimulus package, who really rely and need this money right now, are included in future package. I know that child dependents, adult dependents really could use some of the support and help right now. But if there's nothing else for today, we'll go ahead and call it a Friday. Hope everyone has a good weekend. And we'll send out information for next Friday's call early next week. And then we'll also have information about this regular every other week member check-in as we go forward from here. But I really appreciate you all joining us today. It's good to see everyone's faces. Yeah.
Just quickly, did Algeria get on with the update from the governor's office? Because that call's over.
Not.
I can just give some
No.
quick information if you like.
Oh, great.
So they're going to be extending the stay-at-home order until May 15th. Certain businesses will open, like landscaping. And I did hear golf courses, and people will have to wear masks while out in public places. So that's all I know.
All right. So look for more information probably today or in the next couple of days about all of that changes. We're living in strange times here, but I know I appreciate you all being on the ground and really being a support in your communities. This has not been easy for anybody, including yourself, I'm sure. I know we're all had our struggles with this, and I think as social workers, one of the things we can make sure to do is support each other and check in with each other as professionals, because sometimes we're not okay all the time too. So thank you all for being here. We'll hopefully talk soon, and that's it for today. All right, bye everyone.